Hi there, J.R. Lewis with you on this Wednesday, the 30th of December. We haven't had to do one of these in the form of an update. We've been using our placeholder quite a bit, but there are a few things going on. If you follow the dashboard, you'll see the case count climbing. So Dr. Sanders is going to address that. And also some things having to do with vaccination, including how the rollout is going and her expectations as far as doses in Cordova, and somewhat more immediately, scammers trying to take advantage of the whole thing. So we'll get into those here on today's Daily Briefing on KLAM and KCDV, heard in the 1, 5, and 8 p.m. hours on the radio and uploaded to youtube.com/Cordova TV as soon as we can get them there. Well, Dr. Sanders, it's been a while, which is good news, obviously, because that's what keeps us from chatting. But we've had some activity on the dashboard, so what's appropriate to share as far as what we know about these cases?
Yeah, thanks. Hi. We have 7 active cases right now, and we do know that one of the cases at least started from probably within the community and doesn't seem to be travel related. So we're trying to pay close attention. We sort of expected some of this to happen after the holidays because we know people are gathering, and we just encourage people as we go into New Year and celebrations to really be cautious and really practice the 6 feet social distancing and wearing a mask when you're with non-household members. It makes a significant difference in not just transmission, but the severity of illness. Okay.
Does the community's response overall, though, seem to continue to be on par? Do you feel like folks are holding, to the most part, to the recommendations, or has it slacked at all based on what you've seen? Because this is dragging on.
Everybody is getting a little COVID fatigue, of course, and people are getting sick of not visiting family members and not wearing masks. But overall, I think the community is doing well.
So is there anything then for folks to be concerned about, any different behaviors or anything as a result of this bump in cases, or are these just, again, isolated pockets that seem to be staying within the immediate circle?
I think, and I'm still hopeful that they're pretty isolated, but we're still in the early investigation phase right now. So hoping that it can stay contained because we're just so close to being able to get more vaccine for our community. So yeah, I'm hoping that we can contain it long enough to get that vaccine here and distributed.
Well, and we want to talk about that from a couple of angles too. Before we get into the, any projected timelines or who's next to be vaccinated, that kind of thing, there's some sort of important news circulating about scams, which figures, but what's happening on that front as far as potential?
Even our small isolated community is being targeted by scammers. People either calling or sending correspondence via email or text, asking not just for pre-registration. Some of them are asking for money to help the person be put ahead on a vaccine list. These scammers are savvy and they use the right words. They make their text and their emails appear as if they're coming from a government agency or from the doctor. We really want the community of Cordova to know that we are not sending out these messages like that to anybody. If you get a correspondence, even if you think it's real, we would like you to delete it, whether it's an email or a text, delete it, and call your primary care provider's office. So you can call Elanca or call CCMC to find out if there is no new information or if we were trying to contact you. Please contact us directly. Do not give any payment to anybody. We are not requiring payment right now for any vaccination.
Yeah, and that was the key thing. I did a news story on this elsewhere, and they were the calls range from, again, you could essentially purchase a place ahead in line or purchase your way onto some kind of waiting list. That was one of the scams. Another one was where they were pretending to be the government or an insurance company or something like that, and needing personal information from you before you get vaccinated, saying that the vaccine was mandatory and, that you needed to give out personal data, that kind of thing. So it just, any of that kind of thing should be met with skepticism. Oh, and one of the other ones was saying a new vaccine from some other company was one of the angles. So just anything like that, just report. You're saying double check with your health provider.
We really want, one of the other risks is what we call ransomware or a computer virus that can be attached to those emails. So we really want people to not open them, just delete the message, and then you can contact your provider if you are concerned or feeling like you're missing out on a communication. Contact the provider and they can let you know whether they were trying to get a hold of you or not. We would just like those messages to be deleted.
Right. Okay. And because, of course, if people were actually being contacted by our local providers, it would be a familiar voice and so forth. So, it's kind of nice. Another advantage of living here is that you're going to likely know the people who are getting in touch with you. And if it's somebody that you don't know, then that's a reason to be skeptical.
Exactly. I do think there's a lot of advantages to living here in Cordova. One is that you know your providers very well and the people that will be contacting you. The other is, and I think this is kind of our next topic, but at this small community size, we have a very robust healthcare workforce with Olanka and CCMC that are planning vaccine rollout as soon as we have it available.
Yeah. And there's been some of that going on already. So what's happened with vaccination so far, and what can you, to the extent we can predict anything, what do you see for the near future?
So for the most part, there's an exception here or there, but for the most part, we are entirely following the state's vaccine distribution guidelines. The state is who are supplying CCMC with their vaccinations. We are waiting to hear what our next allocation will be. The state has completed their planning for what they call phase 1, tier 3. And anytime, we expect it sometime today to be getting information on phase 1B, which is the next step for vaccine allocation beyond healthcare workers. So in the next few days, we should be getting those numbers, and next week we should have a time frame available to let the community know a little bit more information regarding how quickly and the number of vaccines we'll be able to provide.
Okay. Are you feeling pretty optimistic? Because anytime anyone has an adverse reaction, we always get a face full of it from larger news organizations. But do you feel like we even had some in Alaska? What is your take on how the rollout is going?
We see reactions from all sorts of things, including placebo sometimes. So in Alaska, as of 2 days ago, we've given just over 13,000 immunizations and seen a very small handful of allergic reactions that have all been easily treated. So I think this is very reassuring evidence that we're watching this vaccine under a microscope. Globally, we're watching it under a microscope, and we've seen very few significant reactions. In our community of Cordova, we've done an excellent job rolling it out with our healthcare workers and our long-term care, and have not had any reactions. So things are going well. The deployment is going as smooth as I could have hoped for, and I think that will continue as we get more vaccine allocated and are able to roll it out to the community in the next, which I anticipate, several weeks.
Okay, well, fingers crossed. And as always, we really appreciate your time. Anything else for us before we wrap up?
No, that's all. Thank you. Have a happy new year and stay safe.
Thanks again to Dr. Sanders for joining us on the Daily Briefing. You will, of course, remember that COVID-19.cityofcordova.net is always available for you to get content. The city's got Facebook pages that you can subscribe to, especially the Cordova Prepared site. If you haven't liked and followed that on Facebook, that's a good way to get information. Heather's working really hard to push the details out. 424-INFO, the phone number for you to call to talk to somebody in the city's response team, and the 424-WELL phone number, WELL. The Village of Eac puts that one out and provides a pre-recorded message on that line. We'll continue to do our briefings here on KLAM and KCDV in the 1, 5, and 8 p.m. hours on the radio, uploaded to youtube.com/Cordova TV as soon as we can get them there. And in the meantime, we'll get back to regular programming with our best wishes to you for a good new year.